Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich. Carlos Saracida is interpreting the press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. As the COVID-19 public health crisis is unfolding across our county, state, and nation, a lot has changed in a very short time. This week has been particularly difficult, as yesterday there was a very significant spike in local positive COVID-19 cases. The very large number of new positive cases reported is potentially the first indicator of a very serious problem. While this positive case increase has not yet created a significant increase in local hospitalizations and ICU bed utilization, leading into the July 4th holiday weekend, it is very concerning. This weekend especially, it's imperative for each of us to avoid the 3 C's. That means we should each avoid crowds, closed spaces, and close contact with people who we don't live with. Governor Newsom took action yesterday to close bars and indoor restaurants across large areas of the state, including Santa Barbara County. Dr. Ann Zorg has issued a new local public health officer order to make the governor's new mandate effective locally. In addition, Dr. Ann Zorg has determined it is necessary to close local beaches during peak hours this weekend to protect public health. This decision was very difficult and is a change from previous policy because of the unique combination of the spike in positive cases yesterday combined with the potential for large crowds at local beaches over the 4th of July weekend. Dr. Del Reynoso will speak directly to the specifics of the beach closures, which apply to all jurisdictions county-wide. Every local government in our county is focused on the COVID-19 pandemic challenge. In all my many years of public service, I have never seen the level of collaboration and engagement from every local elected official determined to work together to do the best we can for our communities. Each of the local government jurisdictions in South County has grappled with the beach closure issue this week and has brought important questions to the attention of the county's public health department. These questions and significant public input has helped inform Dr. Ann Zorg and the county public health department's response. Everyone who has chaired the chairs in these many press conferences has worked hard to present honest, clear, and timely information to everyone in the county. This has not been easy because the scientific understanding of COVID-19 has evolved over time as new information has been discovered. New circumstances and challenges are emerging every day. What may appear as shifting public messaging is simply a necessary adaptive response to the evolving health crisis. As the public health threat from COVID-19 has intensified in the past week, increased compliance with public health orders is more important than ever. For the first 3 months of the pandemic, we relied on public cooperation through education and encouragement. This strategy will continue, but will also now be backed up by increased enforcement. The state of California is using the Department of Alcohol Beverage Control and other licensing agencies to enforce safe operating procedures within open, regulated businesses. The County of Santa Barbara is also increasing its enforcement posture with the staff of the Environmental Health Division of the Public Health Department. These public health inspectors are actively observing food service businesses to ensure safe operations and compliance with all public health standards. In addition to education, public health inspectors have issued notices of violations. Businesses that continue to fail to meet safe operating standards risk closure. Residents who encounter unsafe business operations are encouraged to call 833-688-5551 to register complaints. County staff will investigate all these complaints and will take action to correct violations. While a lot of public attention this week has been focused on the beach closure policy and reports of too many people still not wearing face coverings in public, One of the invisible but very potent threats to transmission of the virus is unfortunately family gatherings. There's a great deal of emerging data, both locally and throughout the state of California, that shows the virus is being spread by family and friends gathering together in private spaces. While it is perfectly safe for immediate family members who live together to recreate and socialize together, it is not safe to extend those contacts to family members and friends who don't live together. Many people may be planning backyard 4th of July gatherings this weekend. To protect from unknowingly transmitting the virus, please cancel those plans or move them to an online format. It's not worth the risk of infecting people you care about by hosting an unsafe event. This year has been extraordinary in so many ways. The most patriotic way to celebrate Independence Day this year is to postpone celebrations with non-family members. Our country has celebrated the 4th of July for 244 years, but this year is different. The most important thing we can do as Americans this Independence Day is to protect each other's health. The best way to do that is to avoid crowds, avoid closed spaces, and avoid contact with people outside of the people that we live with. We will be able to resume all of our important traditions and share our lives with friends and families when we've again regained control of this current outbreak of the COVID-19 virus. Our community has demonstrated spectacularly we can do the hard things necessary to bend the curve of the virus. We're asking everyone to recommit to do that same work right now. We'll now hear from Dr. Dovinoso, the county's public health director.
Thank you, Supervisor Hart. Good afternoon. As Dr. Ansorg mentioned last week, a week in COVID times can feel like years. So much has evolved over the course of last week, and I have a number of updates to share with you today. First and foremost, I'd like to share today's case report. We are reporting 111 new cases today, and we are reporting 64 patients hospitalized with 20 in the ICU. We are currently revising our data dashboard to reflect metrics that describe COVID-19 cases in our county. In addition to the new cases, active cases, hospitalized cases, age, and demographics, we will also be including symptomatic and asymptomatic cases, as well as sharing with you the spread of transmission. I'd like to invite everyone to visit our reopening metrics page on www.sbcpublichealth.org. Please note that you will see updates to our case information, as this is a living data set that we are constantly refining. From the cases that we have investigated, we know that roughly 55% are from person-to-person spread, 1% are from travel outside the county, and 44% are community acquired. CDPH is monitoring counties for elevated disease transmission, increasing hospitalization, and limited hospital capacity. Santa Barbara County has not met the threshold criteria for elevated disease transmission, increasing hospitalization, and limited hospital capacity for the past 17 days, as noted by the California Monitoring Metrics, which is also posted on the CDPH website. July 4th is a time of celebration with family and friends, and beach time is a favorite gathering space for many, many families. We were hopeful that we could keep our beaches open to allow access for our community over this holiday weekend. However, as I just shared, with the increasing cases and with us being on the state's monitoring watch list, and more, as we hear more and more communities are closing their beaches, such as in Orange County, Los Angeles, and Ventura counties, we became very concerned about funneling people to Santa Barbara area beaches. The threat of thousands coming to our community, combined with our increased case counts, lead us to make the decision to close our beaches. Yes, this changes our previously announced decision, but we needed to take action. And here is what it means. Dr. Ansor today issued a health officer order to temporarily close all public beaches in our county starting the 4th of July weekend, 12:01 a.m. on July 3rd, and continuing to 11:59 p.m. on July 5th. No members of the public shall be on the county's beaches during these closure period, except to immediately assess and leave the ocean for water sports and for active physical activity. To avoid gatherings, activities not permitted during this closure includes sitting, lying, standing, sunbathing, sightseeing, picnicking, and all other non-exercise, passive, or sedentary activities. Furthermore, umbrellas, shade structures, tents, barbecues, grills, sand or beach toys, coolers, and beach chairs are not allowed during this temporary beach closure. We made this decision to protect our community and to safeguard our future. The threats of crowds and further gatherings of sizes that could not easily be addressed led us to make this difficult decision. Based on the prevalence of disease in our community and other locations, we did not want to see the impact of not closing the beaches 2 weeks from now. This action is a strong reminder of the interconnectedness of this virus and the need for all of us to fix this problem. Our only defense is social distancing, wearing face covering, and washing hands. This will stop the disease, and this will break the infection chain. However, we all need to commit to this in order to crush the increase of cases. We may, in fact, need to close more than our beaches in the days to come. Please consider this. If we cannot impact the path of disease through taking very simple action as individuals, we will have a difficult future. Broad actions that impact many will need to be taken. During this weekend, I implore every community member to stay close to home and do your best to avoid closed spaces, crowds, and close contact with those that live outside your home. Enjoy time with those who live in your household. Stay 6 feet apart from others when outside your home. Please remember to wear your face covering and wash your hands. Thank you.
Thank you, Dr. Dovernosa. Sheriff Bill Brown is also available on the phone today to give an update on the COVID-19 cases associated with the county jail and also information about enforcement strategies for the 4th of July weekend. Sheriff Brown?
Thank you, Gerhard, and good afternoon, everyone. Two things I'd like to update you on today. The first is the Sheriff's Office response to the beach closures. Just would like everybody to know that we will be out this weekend with augmented patrols patrolling the beaches and also patrols assigned to the trailheads and parking areas adjacent to beaches. In addition to that, we will be out in force in the city of Goleta, which we police under contract, conducting DUI saturation patrols looking for impaired drivers. As far as the second item, I'd like to update you on the COVID-19 outbreak that I talked about last week at last week's press conference. Unfortunately, since that press conference last Friday, we have had 4 additional staff members who have tested positive for COVID-19. In last week's report, we shared that today we're sharing that 2 additional custody deputies, 1 additional custody civilian staff member, and 1 patrol deputy sheriff trainee have tested positive for COVID-19 this past week. 2 of those 4 exposures do not appear to be work-related. The summary of those exposures are as follows. 1 of the custody deputies was away from work on military leave. He'd been gone since June the 14th. He became ill this past week He went in and was tested and was later found to be COVID-19 positive. He is currently self-isolating and recovering at home. He had no contact with any inmates and is doing well. The second custody deputy was at home, and he experienced symptoms that appeared to be COVID-19-like on his days off. He was tested. His test came back. Unfortunately, he was mistakenly notified that the results of the test were negative when in fact they were positive. By that time, he had recovered sufficiently to the point that he was asymptomatic, and he returned to work. He was assigned to guard duty at the Santa Barbara County Psychiatric Health Facility, and he worked 2 shifts at the public health facility. The error that was made in terms of the interpretation of his test result was discovered, and the employee was immediately notified and sent home to self-isolate. As I said, he had worked 2 shifts at the PUF, but fortunately had been wearing an N95 mask at all times during his shift. All of the staff members at the PUF wear an N95 mask as part of their robust regimen to guard against COVID-19 spread. And the custody deputy had not had any close interaction with them or with the inmates. And at this point, there's no indication that there's been any COVID-19 spread at the PUF. The third custody staff member is a part-time civilian employee who is assigned to our custody records section. And this is the area where we believe the prior custody staff outbreak originated. That employee had not been at work since Friday, June the 12th, and she'd had no inmate contact at all. After becoming symptomatic, she sought testing and was found ultimately to be COVID-19 positive. She is also recovering at home and self-isolating. The last employee, the patrol deputy trainee, experienced symptoms while he was on his regular days off, beginning on Tuesday, the 23rd. He did not return to work while the test results were pending. He was subsequently advised that his test was positive, and he continues to self-isolate and recover at home. Contact tracing indicated that that exposure was likely not work-related. As a result of this outbreak, we are committed to redoubling efforts to try to make sure that the jail is kept as safe as possible. And part of that is a commitment to testing all of our jail staff and all of our inmates. This has proven to be challenging because the county, as you'd heard at last week's press conference, has been experiencing a shortage of test kits. I'm happy to say that as of this afternoon, we have received a sufficient supply of kits that will allow us to test all of our inmates. So far, 321 inmates out of roughly 578 who are in our jail have already been tested. And of those, 139 tests have returned negative, 178 are pending results. 1 test was inconclusive, and the inmate has been retested and is awaiting results. 4 of the inmates have tested positive for COVID-19. Of those 4, 2 of those inmates have since been released from the jail, 1 of them on bail and 1 of them on their own recognizance. Both have received instruction about self-isolation in locations other than the jail. 1 of the inmates has recovered from the COVID-19 infection, and only 1 remains in jail, isolated in a negative pressure cell and under medical supervision. Of the staff members, 340 staff members have been tested. 310 of those tests have come back negative. 9 tests are still pending, and 21 staff members total have now tested positive. Of those 21, 6 of those employees have returned to work. 1 of them is hospitalized, and 14 are recovering at home. And that concludes my report. Thank you.
Thank you very much, Sheriff Brown. Next, we'll take questions from the room. Mr. Devine?
Just first question for Mrs. Do Reynoso. You mentioned that if we cannot impact the spread of the virus, we may need to close more. Could you just specify what would that look like? Which specific places may need to close if we don't get better soon?
Sure. As the governor recently on Monday said that all bars and breweries need to be closed, and then quickly on Tuesday added a series of indoor operations of restaurants, of movie theaters, cannot be opened, and all operations of bars and breweries need to close. I believe that the governor will be taking action as our rates continue, and we will not have an option but to follow that guidance. In addition, we as a county, the health officer can issue stricter guidance than what the state issue. And that is something that we are evaluating at right now in consultation with the state and other jurisdictions.
With the beaches being closed now throughout the county, how are you guys planning on enforcing every single beach? A lot of ground to cover. How are you planning on doing so?
We have been in discussion all week with cities and parks and recs and with various members of our law enforcement. You just heard Sheriff Brown shared that his staff will be out and about. So this is a concerted effort, a multi-jurisdictional effort, enforcement, and so we will all be out along all the stretches of beaches in our county to do that enforcement.
Lastly, for me, if somebody were to violate these rules, like you said, laying on the beach, sunbathing, what type of repercussions or would happen as far as the law goes?
So we do the education, as Sheriff Brown fondly says, we're long on the education. And so I believe that we have community members who will respond to that education. Essentially, this beach is closed for this particular activity. You must pack up and go. And in addition to that, we don't want to get there because we will be pushing out on social media that message beforehand. It's already out that our beaches are restricted during this holiday weekend, and so please do not do all these activities that we've just mentioned, that it is very restricted to only active activities on the beach.
So could they see a fine or more of just being told sternly you need to leave the premise immediately?
So we have the fine as part of our tool chest, but again, we really want to emphasize and appeal to our community members and our visitors to do the right thing and leave if they are engaged in a prohibited activity.
Thank you.
Thank you, Mr. Devine. Mr. Molina?
So I know nobody has a crystal ball, and I know things change constantly. There is a perception, journalists talk to people, everybody, all perspectives. There's a perception that the county public health is a bit, or could be more proactive. For example, you just said the county does have the ability to go stronger, but not less. With the beaches issue, public health yesterday on Instagram promoting, come to the beach. Today, no beaches. I'm just sort of wondering what changed. Were you always going to close the beaches, but maybe everyone else didn't know it? But trying to figure out, for those people who think the county is not as proactive as it could be, help me understand what's happening behind the scenes where yesterday the beaches are open, today they're not.
That's a fair question. That's a very fair question. So we started out this week with increasing numbers, but nothing drastic. And we proceeded to say, what is in the best interest of our community while protecting the health? Yesterday evening, we received our case count, and it was 268. Then we also heard that not only, we knew that LA County beaches had been closed. We knew that Ventura was closing. And then we noticed that Orange County, further down, was closing their beaches, starting with Laguna and then moving on to Newport Beach. So in evaluating that, the increasing in cases, as well as the closure of beaches south of us, worried us. And the team quickly regrouped and said, given these changing landscape, do we stay with our original decision, or do we take the new information and pivot and make the best decision for our community? And again, given that it was yesterday was the 16th day, given the 16th day being on the monitored watch list, given the closure of beaches south, we are the safety valve for Southern California, and the increasing cases was just too much for us to stay to our original, and we changed our decision. And we are confident that we made the decision with the new data that was given to us.
Okay, thank you. Just a couple quick questions. There's sort of this rumor out there that we're flying in people from Mexico and other counties who are staying in our hospitals, and those numbers are being counted as part of the hospitalizations. Can you address that, please?
Yes, absolutely. That is a wild rumor. So I know for certainty that there were only 4 transfers from Imperial County into our system, 4, and as of today, none. So those 4 hospitalized patients needed our support, and our hospital system could withstand that acceptance. We live in a great community where we had the hospital capacity to afford 4 patients that needed care, the expertise in our ICU. So 4 only. And those numbers were not counted in our hospitalization count.
Okay, and last question. What is the status of testing? Do you want people to get tested? Are we back to only the high-risk groups? If we do need to get testing, where can we get testing at this point?
So we still have the 3 community testing sites, and in Santa Barbara, it's about a 2-week wait, and in Santa Maria, it's about a 2-week wait, and in Buellton, it looks like a 3 to 4 day. So on-demand testing same day is a little bit more challenging, unless the resident wants to go to Ventura County or SLO County. Those sites have more availability because of the testing not enough residents perhaps are taking advantage, whereas our community, we've been encouraging people to go tested, and we're seeing the fruit of that. However, I can tell you that if you are symptomatic, there is full capacity for you to get tested the same day if you are symptomatic through our hospital system, through public health, as well as among our healthcare system, the private provider practices. In addition to that, the Public Health Department, we are standing up our own testing group, and we are in planning stage where when the state sponsored tests leave at the end of the month, we're planning to host community testing in various communities throughout the county, like what we did in Guadalupe and in Coyama last weekend.
Okay, thank you.
Thank you, Mr. Molina. Now we'll take questions on the phone.
Yes, first up, we're going to Laura Place with Santa Maria Times.
Hello. My first question was regarding data for Country Oaks. Looking at the new metrics that you just said were posted with some more updated information, I see that there have been 10 resident deaths, but I had only been aware of 9. Was the elderly person from Santa Maria that death announced earlier this week, was that a Country Oaks resident?
I'm sorry, Laura, I don't have that information, but that is something that I can get to you after the press conference.
Okay. Yeah, I know with some of the past deaths that have turned out to be resident deaths, that hasn't been clarified in the releases, so I'm just wanting to check. But yeah, I'll email you after the conference if that's okay.
Great.
My next question is regarding further kind of data issues. I know that on Twitter, the public health department said that there was delayed results from the state. But then I saw that in yesterday's numbers, like 150 of them were from either 2 weeks ago or even longer ago. Can you explain how that plays into the state's delayed numbers? Is that like a totally different issue or?
So the difficulty in our county mitigating the COVID-19 efforts is the availability of data and data in real time. So we spent a lot of time these past 2 weeks reconciling our numbers with the state. Knowing that the state is monitoring us, we wanted to make sure that we are reconciling. And there were days where it was an impossibility to reconcile our number of hospitalized patients, of tests versus the county. In addition to that, we have tracers that we have trained, and we needed to be on a state platform. So given the reconciliation issue and the need to be on the state platform, we did the migration of data starting on Monday, I believe. So we're in a phase where on the 29th and on the 30th, we have some data gaps, and we are working on it, and we hope to close that gap today or at best tomorrow. With regards to the state's delay in giving us the numbers, so last Friday, the CalReady system crashed. And yes, that did impact our system, but we were able to receive all of the cases, hopefully all the cases, on Monday. So on Monday, we receive an abundance increase in cases, and that we are trying to mitigate and whittle down.
Okay.
Thank you, Ms. Place.
Laura, was that it, or did you have an additional?
No, that's it. Thank you.
Thank you. Next up, we're going to Gianna Magnoli with Newshawk, who wanted to clarify some questions for Dr. Donoso.
Hi, yes, my question is kind of related to Laura's. Just to clarify, you mentioned 268 cases yesterday. I didn't know if that was only for Wednesday or if that included part of that gap you talked about for Monday and Tuesday.
So, and we are working through and teasing out, but the case count is correct. We right now on our data dashboard, we don't, as of right before the press conference, we don't have the active cases, the recovered cases, but the case count is correct. I verified that before the press conference.
Okay, thank you. And I was wondering, you had mentioned about the source of transmission on the website now, and that's helpful, but I wondered how many, it doesn't seem like a lot of the cases are being able to be tracked down to a specific source versus the community. Can you talk a little bit about that and where you're seeing recent cases be tracked back to?
Sure. So right now, what I see on our website, we have 690 community, which is person-to-person spread, and we have 12 related to travel, and we have 542 related to community acquired, and we still have the 926 under investigation. So what that means is that we are in the process, our nurses are investigating, and our contact tracers are part of that process. So as we finish the case investigation, we will put them in the person-to-person, the travel, or the community acquired buckets.
Gianna, did you have any follow-up?
I was just wondering, with the ones you have determined to be person-to-person, what kind of instances have those been?
So that would be contact to a known case in the community.
Okay, and things like family gatherings, workplaces?
Family gatherings, workplaces, sectors. It's as people increase their movement, they are coming into contact with known cases. And it could be in the workplace, it could be as part of a family gathering, it could be in the same household.
Okay, thank you.
Thank you, Ms. Magnoli.
And now we have a phone number. I believe it's from the Santa Barbara Independent. Please identify yourself. You are now unmuted.
Yeah, hi, this is Delaney at the Independent. I apologize because I was about 5 minutes late trying to get into Zoom and it didn't work out, which is why I'm calling. So hopefully any questions I'm asking aren't redundant. But I wanted to clarify a couple things. When it comes to enforcing the beaches this weekend, I was curious if the Public Health Department had any conversation with Ventura's Public Health Department. I know that they had a pretty similar standard earlier on in the, or ordinance, earlier on in the pandemic, where they had exercising only, but you weren't allowed to like lounge on the beach. And I'm not sure if that was really successful for them or not. It seems like it wasn't, since they are no longer employing that and they're just straight up shutting everything down. And I was just kind of curious if our public health department had any communications with them about that, and why that was maybe a better route than just shutting it down altogether.
We were in conversation not only with Ventura County, but with LA County, with other jurisdictions that in our state. We did not talk about why Ventura County chose to do a more restrictive beach closure this time around, but we took into consideration what was best for the Santa Barbara community.
Okay, and then kind of on the same note, what are epidemiologists projecting for 2 weeks from now? Obviously, people are more active as far as being participants in the economy and going downtown. And now that people have more of that attitude, much more so than they did on Memorial Day weekend, perhaps, is there any different kind of projection for 2 weeks from now on what COVID cases will look like?
I can talk from a state perspective. When Governor issued the guidance for our county to join other counties on the monitored list to restrict sectors and cease indoor operations for restaurants and high touch points such as movie theaters and et cetera, that was in the hope of decreasing the contact points and avoid mass gatherings. So these efforts, like the beach closure, like the restrictions on the bars and the restaurants, and facilitating only outdoors activities, that is all with the hopes of decreasing the number of cases and decreasing the number of hospitalizations.
Okay, but just as a little bit of a follow-up, is there any actual number of projection hospitalization-wise that locally we can say probably it'll be about this many people in the hospital 2 weeks from now, given the closures that we're putting in place to try to mitigate that?
So if you're talking about modeling, no, we have not done our local modeling. However, the state has done modeling, and I'm more than happy to share with you the site and the information. I don't have it readily available right now.
Okay, well, thank you. That's about it for me.
Thank you very much.
Those are all the questions that we have.
The Board of Supervisors will hear a presentation on COVID-19 at 9 a.m. on Tuesday. This presentation can be viewed on County Channel 20 or the county's website. If you have any questions, please call the county's call center line at 833-688-5551. There will be an operator available this weekend to answer questions. As always, I want to remind everyone to please continue to practice these 3 simple steps every day. Remember to wear a face covering and stay at least 6 feet away from other people. Wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And if you feel sick, stay home and isolate yourself. If your symptoms worsen, call your doctor or clinic and follow their medical advice. Please continue to be patient, considerate, kind, and safe. We can and will survive and even thrive beyond this very difficult event. We've all learned a great deal about our own personal resiliency. Most importantly, we have learned that we are stronger together. Thank you for joining us today.